I was motivated to design our practice to accommodate, urgent visits or emergency visits because that's what I would want to find if I was in their position, is to find a place where we could be seen fairly quickly, be provided information as to what's going on, why it's happening, and ultimately get treated, during the same visit. That builds confidence, I feel like, and it actually provides a service to where it gets them comfortable. Are we going to be able to solve everyone's emergency? Each time we see them, each time we get an emergency visit scheduled? Absolutely not. But we strive to take care of the majority of situations as quickly and efficiently as possible. And we've invested in technology to be able to do that, to gather information, whether it be with digital x-rays or to actually treat the patient with CAD cam technology and equipment. If I was a patient seeking treatment because of an emergency, that's the kind of things I would want to look for, and that was kind of my mindset as far as how to set up our practice to take care of those issues. True dental emergency can mean a lot of different things to different people, but symptoms that people should not ignore are anything that involves swelling that is noticeable. If they're running a fever, or they're noticing just an increasing amount of pain or duration of pain, it's something that they should definitely give us a call so that we can assess whether it is an appointment that's needed at our practice, or if it's a bigger emergency, if maybe we need to recommend them seeing an urgent care facility or potentially even the emergency room. Our approach is different in that, being a small private practice, we really strive to get to know our patients. And so being able to understand maybe what profession they're in, understanding that, if a broken front tooth happens and they have a presentation because they do a lot of speaking at their job, we understand that it's something that needs to be taken care of quickly, not only to get them out of pain, but because they need to function at their work. Also knowing that their schedule is quite hectic, whatever we can do to try and incorporate an appointment into the day, even if it's a little bit longer than it typically would be. I feel that we're able to do that being a smaller practice versus maybe a larger office or a corporate structure that may have them go through specific scheduling protocols to get the appointment made. Patients can feel better about being able to call us and speaking to one of our staff members that they probably would have gotten to know well over the years that they've been coming to see us. An emergency appointment, we'll try to get scheduled as soon as possible. As soon as they get into the office, we'll try to get them seated in a chair. We'll do a visual assessment of what it is that brought them in, what's going on. Is it a broken tooth? Do they feel like there's some swelling happening? We may recommend x-rays depending on what's going on so that we can further, kind of diagnose the source of the problem. And from there, we can kind of treatment plan what we think would be the best outcome to provide them, procedure wise. So it could be anything from filling, if it's an extraction, or if it needs to be something a little bit more comprehensive, restoratively, like a crown, something like that. We can definitely go over all the options once they're here. If it's something that may require the help of a specialist, then we can kind of help them, get scheduled, give the specialist office a call, see if there's any available appointments for them so that we can kind of streamline things in that process. But it's really just gathering information and then trying to get whatever treatment done that we can that day, taken care of for the patient. A lot of the same tools and treatments that we use for our day-to-day cases we actually utilize for emergency cases as well. So x-rays are typically involved in an emergency visit. We have our CEREC CAD CAM system available to us to kind of utilize for treatment that may involve broken teeth or a broken tooth itself. We have our CBCT 3D X-ray to kind of assess areas where the source of an infection may be coming from. And these are all instruments and tools that we have at our disposal, not only just for emergencies, but just for our everyday patient care as well. There are some types of dental pain and trauma issues that patients kind of wait too long on. Some examples will be, jaw pain. Sometimes, people have sporadic pain in their jaws that may be due to clenching or grinding. They kind of wait on it because it doesn't happen every night or every day, and it doesn't happen for the same length of time. But those are things that we want to look at and try to treat proactively so that the condition doesn't worse. Sensitivity to cold and to heat, that may seem tolerable for patients for a certain amount of time, but slowly it starts to increase in duration and severity. We need to assess, is it, an issue that we need to take care of because if it's related to a cavity or maybe loss of tooth structure. We kind of want to figure out why it's happening before it gets to a point where it's unavoidable to get certain procedures done when we had a chance to be a little bit proactive and taking a preventative approach towards the problem. We help patients feel calm during emergency visits or urgent visits with information. I think patients really feel more at ease when we're able to kind of talk to them, tell them, what's going on, what options are available to them to kind of help take care of the issue that brought them in to see us. A lot of anxiety, I feel like, is just the uncertainty, like why am I in pain or why did this break? I think, kind of going through exactly the progression of the problem and maybe where they're at in that progression really will help them get comfortable knowing that, they understand, the source, and then the options that we have available to treat it really puts them at ease and, gives them confidence in my office's ability to take care of them. If you're experiencing a same day emergency or tooth pain, give us a call. Same day care is available.